Welcome to everyone who's just filtering in. We're going to give it a couple more minutes for some late joiners and we'll get started in a few. Okay, everyone, thank you for joining the Carmel Clay Public Library in our Wellness Wednesday program. Today, we're going to be doing tips for starting therapy. So before we really jump in, I want to go over some housekeeping things with Zoom especially. My name is Erin. I'm a programmer here at the library, and I'm happy to have you today. I'm so excited. So in terms of just getting things out of the way, I want to discuss that this program is going to be recorded. You are not going to be recorded. Just the conversation between Libby and I is going to be recorded and then shared on the library's YouTube page, hopefully tomorrow by Friday. So this is just pretty much a blurb of your information is not going to be shared at all. You did have to put in an email for registration, and I think you had to put in an email to get on this Zoom, but that's not going to be shared. Like Libby is not even going to get that information. So that's all just for me. It's not going to be shared with anybody. And if you have additional questions, feel free to contact me. My phone number is up here. That's my direct line, and my email is up here as well. So if you have questions about privacy related things, let me know. Moving on to Zoom. So even though Zoom has been around for about 3 years, some people made it through the entire pandemic, never even using Zoom. So I just want to make sure that we're kind of on the same page. First of all, this webinar is being recorded. You should see maybe up in a corner here somewhere that there's a little record button. Just me and Libby being recorded, that's it. And then on the lower portion of your screen, this image is from my phone. So it depends on whether you're on a phone or on a laptop or even calling in. It's all going to look slightly different, but the icons are going to be the same. This icon here with the headphones, just make sure that you've joined the audio so you can hear. I just now realized that I'm telling you this, and if you don't have it turned on, you might not be able to hear me, but that icon is just making sure that you have everything connected in terms of like your headphones or speaker, if you're dialed in. For this webinar, neither the chat or the raise hand feature are enabled, just because I want to protect people's anonymity and privacy. We're not going to be chatting with each other today, but you can ask questions, which we'll get to in a second. We do have captions for this webinar. They're going to be generated by Zoom, so hopefully they're going to be fairly accurate. You can get a copy of the transcription when this is over if you've enabled those. So, and then finally, our Q&A feature. This is going to be a big part of the program today. If you have questions at any point in the program, this is where you're going to be able to ask us questions. So you can ask a question anonymously. That is a feature. It's just something that you have to toggle on. So if you want to remain anonymous, feel free to do so. Those questions will be addressed at the very end. So Libby and I are going to have a conversation for about 40 minutes, if that, and then we'll get to the questions after. So, okay, let me introduce myself a little bit more, and I'll stop sharing my screen here. Stop share. So again, my name is Erin. I am a programmer here at the Carmel Clay Public Library, and I do programs specifically designed for this new adult demographic. This new adult is kind of an emerging term lately. It's really targeting, I would say, people coming out of high school into their mid-20s. So those are the kinds of programs that I do. But if you're not in that demographic, you are more than welcome to be here. I'm so happy to have you. And I do all of the wellness programming in the adult department. I don't have anything to do with the teen department or the children's department. We have lovely programmers that are doing great things over there. So that's about me. Lastly, my pronouns are up here in the corner. I use she, her, hers, and they, them, theirs pronouns. You can use both sets for me. You can use one or the other. I'm very flexible. So that's up there for your reference. And then I am so lucky and so fortunate to have my friend Libby here today with us. Libby Saylor is a social worker. She is licensed in Michigan. She's a therapist. Libby, do you want to say anything about yourself right now?
Yes, thank you for the introduction. I think it's been a great introduction so far just into this wellness webinar. So I also want to say thank you to you and to the library for having me and letting me join and be a part of this. So yeah, my name is Libby. I use she, her, her pronouns. And I have been in the social work field for probably around 5 years now. In the last 3 years, I have been focused in clinical social work. So I'm predominantly focusing on like individual therapy with clients here in Michigan. So yeah, that's kind of where I'm at right now.
Yay, thank you so much for that little intro about yourself. So to kind of go over a roadmap of what we're going to discuss today in the next 50 minutes or so, well, I guess probably 40 minutes, and then we'll have time for some questions, is we're going to have a conversation. At any point in time, again, please feel free to use the Q&A feature. It's marked by kind of 2 little text bubbles, and then the icon, the letters Q&A. It should be at the bottom of your screen. Again, you can post questions anonymously or not, whatever you want to do. And then we'll answer them live. We're not going to answer, I'm not going to type responses. Libby and I will answer those, or I'll be asking the questions, Libby will answer them. We'll answer those live. So, and then at the very end of this program, I do have a survey for those of you who love to give feedback. So I will post that at the very end. So keep a lookout for that. And if you have to leave early at any point in time and you want to give feedback, feel free to email the library. If you want to give it anonymously, you can email us and I'll send you the link, and then you can give us anonymous feedback that way. So, all right, let's get started. Oh, for those of you watching, you may see me turn slightly to one way. I have my questions on a different monitor, so that's why I'm looking away. I'm still engaged. Okay, Libby, are you ready?
I am so ready.
Okay, so what is therapy? Like, this whole program is about therapy. What is it?
Yes, great question. Because therapy is used in a lot of different realms. So it can be really almost vague when people are like, oh, therapy. So great question. So basically, therapy, talk therapy is another term for psychotherapy. So basically what psychotherapy means is it's just the mental health, like, professional's term or definition of the way that we communicate with our clients regarding like overall mental health or overall well-being. So with this in mind, talk therapy or psychotherapy, it's directed towards what the client or patient is wanting to focus on processing. And this can range from anything, anywhere from like relationships to medical illness, grief or loss. Another thing that I like to do is I almost like to compare therapy sessions to a doctor's appointment. In the way that if you're needing support with something, it's a place that you go to get your checkup, and support as needed. Sometimes just an annual checkup is needed. I like to see therapy just like that, but it's really focusing on like a mental health checkup on your mind and body as a whole. So yeah, that's how I describe what therapy is.
Right. So when I go to the doctor, typically something's wrong. If I'm not depressed, why do I need therapy? How can I benefit from having a therapist?
Exactly. Great question. So there's a really big stigma or belief that you have to have X, Y, or Z, or you have to be referred to engage in therapy services. And that is just not the truth. You definitely can, but it's not, you don't have to meet a criteria. Anybody can be a part of therapy. So just to, re-explore that, you don't need to have any adverse experiences or traumatic incidents to engage in therapy. So like I mentioned earlier, thinking about therapy as like a physical with your doctor, there may not be anything wrong, but it's still good to check in to make sure everything's going okay and that you're supported. So some clients utilize sessions to process current events, work stressors, whatever may come up. And once again, you do not have to have a mental illness or a diagnosis to benefit from therapy. We all deserve to have space to freely process life events and our experiences, regardless of what that may look like. And honestly, in all honesty, we're typically not taught how to interpret our thoughts and emotions, nevertheless, how to process and like cope with them in the current moment. So I think with that in mind, therapy is a great benefit for really anyone who may be interested in understanding or learning more about themselves, how to communicate, how to process and cope with emotions that we all face.
Okay, I think I'm picking up what you're putting down. So
Okay.
like you said, you would go to the doctor for a physical. I don't know how often you would get a physical, but I'm only going like once a year. So how often should I go to therapy?
Exactly. Exactly. And it really just depends on each individual. So usually what we look at is if there's a presenting issue. Once again, there doesn't have to be a presenting issue, right? But if there is one, if we're looking at like a scale, maybe someone's having an issue and it's pretty severe what they're going through. If that's the case, we would definitely want to start at least once a week, to be able to build up that consistency and maintain and have that space for support. But let's say we just want a place to check in, a place to hear some perspective or support or feedback. You can do one time a week, but sometimes people actually prefer to do it bi-weekly. So that's meaning like every other week. I've had some clients who feel pretty good, but they want to check in every once in a while. So we can even do like once a month, but it really just depends on your preference, your availability, and also accessibility. So if it's not financially within your means to do weekly, your therapist should be able to understand that and work with you to make sure you're still able to receive services, but it's accessible for you.
Once a week sounds like a lot.
Yeah,
I
it
don't
definitely can be.
I don't know if I would want to see my doctor once a week. So let's talk about the different kinds of therapists. So you are a social worker,
Yes.
but there's also psychologists, there's like licensed mental health counselors. Why is it important to know the difference, and what is the difference?
Yes. There are so many random acronyms at the end of people's names. It gets a little confusing. So that's a really great question. Sometimes I even get a little confused. I'm like, which one is which? What's going on? So sometimes people like don't have a preference for the mental health professional of what their title may be. So some people are like, it doesn't matter what the background is or what the acronyms may be towards their licensing. And that's totally okay. Some people really do like to know what the credentialing is, because basically what's important to know at the end of the acronyms is that you go through different trainings and experiences to get to your licensing. So for specific titles, there are different requirements that are needed to obtain the title and position. So for an example, an LMHC, so that's a licensed mental health counselor. They need to pass their exam through the National Mental Health Counseling Boards, as their degree is focusing in psychology or sociology at times. For myself, I'm an LMSW, so that's a licensed master's social worker. And who I go through, my board is through the Association of Social Work Boards. And that's where I take my clinical exams and have to obtain my hours and education to uphold. And that's because my background, like I said earlier, I have my bachelor's and my master's in social work. So that's why I report to the ASWB. So once again, this information, it might be important to know because for varying degrees, titles can help explore what the therapist has had training in, what they've had to focus on, or if they've had any concentration in something. So for social work, there's a really heavy focus on being inclusive with social determinants, meaning how is the social environment, how is our outside environment impacting our internal well-being, where maybe in a different realm, maybe in a psychology degree, they're not really focused on those social determinants and they're more focused on the interpersonal sense. So we all share the interpersonal I guess, studies, right, and experience. There's just some other specifics, concentrations, or understanding and training that other people have had that maybe other people with different licensing doesn't have. So that's why it can be important at times.
Okay, that sounds like a lot of information to weed through sometimes.
Yes.
So for some people, it doesn't matter, like the acronym or what kind of background a therapist can come from. Let's say it matters to me, and it sounds like education is a really big part of what acronym, what title you end up with. So what kind of education does it take to become a therapist?
Yes. So I'll speak from my experience, kind of my like roadmap to my title now. So I received my bachelor's in social work. And then within that, I was able to go to my graduate program and receive my master's in social work as well. So more specifically, in my graduate program, I was able to pick a focus. So I could pick maybe like community outreach or policy or programming, data, right? I decided to focus on the interpersonal pathway. So that focuses on the clinical side of social work. And once again, there's so many different pathways social workers can go into, but one realm is therapy. And so that's what I decided to concentrate with. And so I graduated with my master's in focusing with children and their families. So that is kind of where my role is. With a master's degree is really the focus. If you want to lean into clinical work, you do have to go into your master's to get that.
Yeah, it sounds like a master's or some sort of higher education is pretty much like across the board required for therapists, would you say? Some sort of
Yes.
higher ed? Yeah.
Yes. Yep.
Well, you mentioned that you specifically focused on children and their families. So like, I guess different therapists have different focuses. And so it's kind of getting like beyond the title, then you get into your own thing. So
Yes.
I guess like what are the different things that a therapist could be practicing in? So you do like children and their families, like do other people focus just on adults? Do they focus on like specific kind of traumas?
Yes, yes, definitely. So I focus on youth and their families. And interestingly enough, youth goes all the way to age 25. So I'm working,
Okay.
that's kind of my, I would say, my specialty, my focus, what I specialize in, whereas other, like I have coworkers who only work with adults. And maybe some only work with clients who are grieving. Maybe that's their specialty is grief and loss, or postpartum. There's very differing like focuses that you can really lean into, but yeah, sometimes there's specific which we might get into later, but interventions where there is a focus, where the therapist would specialize in maybe trauma if they had a specific certificate in, let's say, EMDR, which I can explain later, but they would have a focus with trauma. And so that's why sometimes it's good to know what the background is, because then you can kind of see what is this therapist going to connect with me and meet my needs and what I'm needing support in.
Right. So you mentioned EDMR. There are so many acronyms. So we have all these different acronyms for titles, and then you get into all the different acronyms for modalities. And so like I've heard CBT, EBT, EDMR. What is going on there? What are the main modalities, and then how do they differ?
Yes. So I would say every therapist has the same modality of, like I said, psychotherapy. That's kind of the other term of talk therapy. That in itself is an intervention, just the talk therapy. It's an approach on how to communicate and support clients and meeting them where they're at. So I would say we all have that experience. And I would say also, since there's more acronyms that we're talking about, this also can make it very more confusing for clients to figure out, like, does CBT, does this or that fit me well? Usually what will happen is the therapist will be able to assess and let you know what maybe you can benefit from. But yeah, so for instance, EMDR, that is eye movement desensitization reprocessing. And that is a specific intervention where we're focusing on processing a single or various traumas or a traumatic event. And so that's very specific. So you're going to go in there and just focus on processing that, where maybe if a therapist focuses on CBT, which is cognitive behavioral therapy, they're going to focus more on the cognitive, the mental, the thoughts that influence our emotions and then therefore influence our behaviors. So there are so many different interventions, but a therapist should be able to have experience in multiple modalities, to where usually the best practice, at least for social workers, is to use varying interventions to make it person-centered, to make it like specialty for that individual, since we're all unique and different and have and need different needs. So yeah.
Okay, thank you.
Yes.
So now that I know all of this and I'm like ready to jump in, where do I go? How do I actually find that person who's going to be good for me?
Yes. And I want to also just disclose that it's so overwhelming, the beginning of this process, because there's so many acronyms, so many interventions. What do I do? Where do I go? So you can always do a quick hop on Google and find various websites that you can search to find a therapist. Some common ones are Psychology Today. I think a lot of people are familiar with that one. Therapy Den. That is also another website, but there's many more than outside of those two. So if you don't have access to the internet, which maybe you would not be participating in this, but if anybody hears this in the future,
You could come to your local library and have access to the internet
exactly,
for
come to the
free.
library, hang out with Erin. But yes, you can always ask your primary care physician, so your doctor, for a referral to a mental health services. That can always be a good start. But yeah, sometimes even in the like Psychology Today, you can filter in what are you looking for. Some people have a preference of they want someone that is female presenting, or someone that has maybe a same identity as them, and it's important to them. And usually on those websites, those are disclosed, so that can be helpful to find like your perfect match.
Right. Like if someone wants a specific like religious affiliation, I know you can filter for that on those various websites too. Gender is a big one, sexuality. And I think on Psychology Today, you can do like those different interventions every once in a while, or specialties. Like I'm looking for a therapist who has experience with clients who have ADHD or something like that. So
Exactly.
great. When I'm finding this person, so maybe I'm on this person's profile on Psychology Today, what should I look for in them? Or maybe I'm been referred to an office, a private practice. What should I look for? What are those like green flags that you look for?
Yes. So for me personally, I'm biased, but I do like to look at their title and their credentials, so I know what kind of background they have, like we discussed earlier. So I think that's always important. I also make sure that my preferences are aligned as well. For me personally, with my own individual therapy, I prefer a female presenting therapist and someone who also has experience with neurodivergency. So I also really like to focus on that they have an experience with whatever presenting issue I'm coming in with, or that I want to focus on. So that could be relationship support. Maybe I have depression or anxiety. So I want to make sure that they have experience in that. Once again, you don't have to have a diagnosis to get this support. You can just come in and just have this as a space to reflect and receive feedback. And that can just be known as like just everyday life stressors that can be kind of a helpful way to, I think that's how they'll put it on their website, if that makes sense. So, and also like when you're in the office, when you go into the session, you might do virtual, and that's very typical nowadays. But if you're going in person, the office can also be really telling. So it can be like really good indicators to help you explore if they're a good fit for you or not. So such as their decor, maybe mottos that you're seeing, or quotes. If it's, a cozy, comfortable fit, if it feels right, that's always a plus. But if you feel uncomfortable, or it just doesn't feel, what is, if you just kind of have this inkling, then you really want to check in with that and make sure, because you deserve to have such a vulnerable space. So you deserve to make sure you feel safe in that environment. That's probably the most important thing to have.
Yeah, I always appreciate when an office has white noise machines everywhere, or like maybe some sort of sound machine that has like running water, or that just makes me feel like comfortable not only waiting, but then like inside I know that there's kind of some noise to just like, protect my that everything stays between me and my therapist.
Exactly.
I want to touch on some of the things that you said. So you said like when you look for a therapist, do therapists need therapy?
They do. We are humans too, surprisingly so. No, this is always a really good question, because some people really do think therapists are just like, we have all the skills, all the knowledge, so why would we need to go? for me and for the ASWB, my social work board, what I lean into, it's a really big ethical standard that we do believe in what we do. So getting support, I do my weekly therapy on Fridays every week. Sometimes I drag my feet. I don't want to go, but I know it's good for me. Even as a therapist, I have those same thoughts. But it's so important that we also have a space so we can learn, and sometimes we can even have different perspectives that can help support in our own sessions that we're conducting. Of course, it can't be anything that would relate to any bias, but interventions that could be helpful or statements that can be helpful. But yes, I always encourage therapists that therapist needs therapists. Everyone can benefit. So yes.
Right. And then another thing that you mentioned, again, like you don't need to have a diagnosis.
Yes.
And I think it's really important for people to know, for folks to know, like you are seeing it when you go into therapy, you're seeing a specialist, but it's way easier to see a therapist than it would be to see, like, I remember after a car accident, I had to go see a neurologist to get that referral to go see that specialist. It was so hard.
Yes.
It was so hard, but I think it's, it's important to say, like, this person is just here for you every week. And it's really not that hard to get, once you find that person, it's not that hard to get in.
Yes. Exactly.
Yeah. Okay, moving on. So I found my therapist. I finally have a person. I'm going into sessions with them. How do I set a boundary with my therapist? Like, oh, I really don't want to talk about my childhood emotional neglect today. How do I say that to them? What if I'm not comfortable doing that?
Yes, exactly. I think the beautiful thing about therapy is this, I would say this is one of the most safe environments for us to practice those uncomfortable conversations. Because this is where you learn those skills. This is, I can't tell you how many times a week I'm talking about just psychoeducation about boundaries and how necessary they are to maintain healthy relationships. And so since I'm saying that, I also want that to be reciprocated in my relationships with my client therapist relationship and my rapport. It's so important that you have strong rapport with your therapist to where you can feel comfortable. Even if it feels uncomfortable, you're still able to share, hey, I'm really not liking how this is going, or I really don't want to talk about this today. But I want everybody to know that boundaries are so welcomed by us therapists. We get excited, we get proud when we hear boundaries. And to us, I see that as self-advocacy and self-autonomy. And that's something we want to empower and encourage, not diminish. So the therapist should disclaim that you are not obligated to share anything that makes you feel uncomfortable. That's always a green flag, right? So therapists are human. We make mistakes. So sometimes we might do something that doesn't sit well with you, or maybe it might feel invalidating at the time. Being able to revisit that and communicating this to your therapist is really important to continue to build that strong rapport of the client-therapist relationship. So being able to state, hey, I just want to let you know, X made me feel uncomfortable, or I appreciate that you really want to focus on this today, but I would rather focus on Y. So those are various ways to explore boundaries and to redirect in sessions. And your therapist should be more than welcoming of those. And that can also be telling of if that therapist is the right fit for you, how they respond to those boundaries.
Good to know. Good to know. So during my session, I've noticed that a lot of therapists take notes. Should I be taking notes? Why is my therapist taking notes? Like, what's the purpose?
Yes. So you do not need to be taking notes at all. Only if you find it to be helpful to maybe remember what was being discussed during the session, or maybe if you get homework from the therapist. Some therapists take notes and others don't. it sincerely is just a preference. And so for me, I take notes because one, it helps me remember important topics, maybe the presenting issue. I'll write down people's names so you don't have to repeat it over and over again. Or sometimes, I'm a visual learner. So being able to look at that paper and the notes can help me kind of connect the dots or see a possible pattern or possible themes that are coming up to help support and process with that client. So that's why I like to take notes. It can be intimidating, but usually those notes are just focusing on being able to support you, see patterns to empower and encourage you to resolve any conflict or whatever issue may be arising.
Right. I think it definitely can be intimidating, and people can read into it. So how do I know that is my therapist judging me when they're taking notes? Are they writing bad things about me that I can't see?
Right. Yeah. And so valid to feel that, because it's so common for us to feel so vulnerable in these settings, and it can make us feel very uncomfy. So therapists will offer feedback and sometimes explore other factors or perspectives to support your understanding. And sometimes this can feel like a judgment, even a client, maybe I'm just writing down what they're saying, that can still come off. The impact could be coming off as maybe this fear of, is this therapist judging me? So it's really important, if you feel you are being judged, it's really crucial that you communicate this and express this to your therapist to see how or if things can change. So if you don't feel comfortable, expressing that, or you have, and there was a negative response that didn't sit right with you, that's when I would suggest looking for a new therapist that can accommodate your needs. But we're ethically bound to not judge and bring our bias in. Speaking on my behalf, as a clinical social worker. So we would actually be going against our ethics if we were to sit there and just judge. And typically that's not what we're doing. We're just trying to figure out patterns and ways to support and cope.
So you're not supposed to be judging people.
No.
That's
Nope.
good.
That's a red flag.
Yeah, that sounds like a red flag if your therapist is judging you.
Yes.
So let's say I feel safe enough to, explore my feelings and set those boundaries with my therapist. How do I know that my information is confidential? How does confidentiality work? Even, let's say, in that shorter consultation session that you might have.
Yes. So, as a therapist, I have a legal duty as a mandated reporter. So this means nothing will ever be disclosed outside of therapy sessions unless there is harm to the specific client or onto others. So this is the only exception where confidentiality has to get breached. So, and it starts all the way from the consultation session. So there's any vulnerable conversations we are having, that always stays inside of these sessions. But if there's any risk, or if there's any communication about there being any neglect or suspected abuse for children on a minor or older adults, as that's very common, I would have to breach confidentiality as well in order to protect the safety of my clients and the safety of others just in general.
Got it. I think that's pretty straightforward.
Okay.
So, like you mentioned, if there is harm specifically maybe to a child, that kind of gets into my next question. What if my child is in therapy? How does confidentiality work then? Why is it important to keep that confidentiality?
Yes. So confidentiality still goes the same for working with minors. So once again, if they have a threat of harm to themselves or others, or report any type of abuse or neglect from an adult, I do have to disclose that information and report that and breach confidentiality. But outside that, we can talk about themes or coping skills to reinforce at home with mom and whomever else or guardians, we can always explore that. I always like to ask if that's okay and what we want to share and what we don't with my client, no matter what age they are. If they're okay with that, then we can implement that. But I am not able to discuss verbatim what we're disclosed. I cannot disclose to parents or guardians what they're talking about, how they're feeling. So I hope that was a little more helpful or brought some clarity.
Yeah, that is helpful. So, like we mentioned earlier, if my therapist is judging me, that's a red flag. So let's say I see a lot of red flags.
Mhm.
How do I know, how do I know if my current therapist is no longer serving me?
Yeah. So basically, if you have met all your goals and you feel confident moving out of sessions, that's a good indicator. Also, if you don't feel comfortable or safe with your therapist, like you're seeing a bunch of red flags, like you just mentioned, that's a big sign that this therapist is not serving you, and you deserve to look elsewhere for services to best support your needs.
So how do I go about doing that? How do I break up with my therapist per se?
Yes, I love that rhetoric because I am such I love the language of hiring and firing your therapist. It's all in your control and you deserve to have that space. So you can let them know in person during a session. You can give them a phone call, an email. If you have their number, you can reach out to them that way, to just let them know that you don't believe that they're a good fit for you or for what you're looking for at this time. And that is okay. That is part of our practice. So no need to feel guilt or shame or anything around that. We want you to get the support you deserve. So actually being able to say that to your therapist, they can actually help you connect with a better match for you. So don't be afraid to explore this with your therapist because they're not supposed to personalize it. And we would rather see it as an empowering way towards clients' autonomy and your own self-determination to get your needs met.
So I shouldn't ghost my therapist.
No.
Okay. Okay.
No,
I've never done that.
no. I haven't either. No. We're all human and it makes sense. But sometimes if we avoid that interaction, we might lose another opportunity for that therapist to connect us to the therapist that we need or that clicks for us. So I
Yeah.
wouldn't want you to shut down or close those doors and not have those opportunities if they do arise.
Yeah, they're ultimately there to serve. I don't like the word serve, but your therapist is there for you, whether they're a good fit or not.
Yes.
So that's very nice. So, well, let's say I like my therapist, but I need to not see them anymore. Maybe I'm moving to a different state where they're not licensed, or I'm changing my insurance and I'm not covered anymore, or maybe I just feel like I want to stop therapy. So how does therapy end?
Yes. So basically, how therapy can end is it can be, well, it's important to know that. So termination is the clinical word for therapy ending, in the setting. So they say that termination starts on the first day of the session, actually. So that's, meaning that therapy is supposed to be as needed. So typically, once you've met your treatment goals and you feel comfortable with the skills and learned, and there are no other goals, or you're kind of feeling a lull in sessions, that's usually when we would want to come to an end. This doesn't mean that you can't go in and out of therapy services throughout your life. I always see it that you should use it as needed. So there's been times where, as a therapist now, I do regularly go to therapy, but in my younger years, maybe I really needed support for a couple months, and then I felt okay, and I wanted to practice outside of a therapy setting. So I took a pause, and then I hopped back in. So it's really, once again, the client should be in control of when they want to participate or when they're ready to end.
It's all about that self-determination again.
Yes, you being in control. It's your guys' world. We're just living in it and trying to support and guide. That's all.
I love that. Well, so we've got about 4 more minutes for, conversation between you and I. So if you, the audience, have questions, you can use the Q&A feature. These are just kind of, some of these questions are, maybe they were Erin's questions.
Okay.
Should I follow my therapist on social media?
We do not
I want to be their
recommend.
friend.
Right. Right. And here's a beautiful quote I heard of, you want to be friendly with your clients, but we cannot be friends. The issue with that is to protect, ethical standards and also to protect you and yourself. So we don't recommend that people follow their therapist on any social media platform unless the therapist is consenting to it and is encouraging it. For me, I would not, be doing that. So in my focus, this breaks the ethics of the relationship of the client therapist. So I would have to say a hard no, but everybody is different. And, some people actually make their own platform right on social media as like a therapy page. And so, that's a little different. Maybe they are more welcoming, that therapist, for them to follow the page. But for us over here, we don't want to interrupt or be inappropriate in the therapeutic client relationship.
Good to know. But can I ask my therapist personal questions about their life?
Yes.
About their cats, for instance.
Right. Yes. So usually therapists will disclose information, and usually it's meant to support and guide in sessions. There's a boundary though. We don't want to be taking up your time of talking about ourselves and our lives, right? We should have our own therapy for that. So basically, when it comes to like animals, stuff like that, there's nothing wrong with that. But, it's some of the things that we want to know, like, I don't need to disclose if I have a partner or if I don't, or where I live, or, what sometimes some people will ask if I'm on medication or if I have any diagnoses. Typically, we don't respond to that because it's not, whether you know that information or not, it's not going to impact the effectiveness of the session. So it's not really needed to share that. And that's just going along with the ethical approach of, we want to be friendly to our clients, but we don't want to be friends because that breaches our standards for our practice.
That makes sense, I guess.
Yeah. Hard.
So, you mentioned before, like, there are those specific therapy pages. Like, one that I really like to follow is Queer Sex Therapy. And that's something that is like, they have a newsletter that I subscribe to. So how seriously should I take health providers in general on social media?
Yes, there is such a fast growing pace of social media outlets with varying mental health advice and skills and whatnot. So I always say, like, you should feel more than welcome to bring in anything you resonate with to your therapist so they can confirm or maybe add in like the correct or maybe more updated information. So we make sure that you're getting accurate and effective understanding and skills. So some providers, once again, are solely based on social media, encouraging people to lean into their page. And I always say, just lead with caution, as you don't know what their title may be or their positionality, and that can impact the content that we digest. So always lead with caution, anything on the internet. I always tell people, if you find something on TikTok and it resonates, talk to your therapist about it. They'll be able to support you or help redirect in what part is truth and maybe other parts that could be helpful to know.
That makes me think of, like, I know a lot of people who have said, I think I have ADHD now because of TikTok.
Yes.
Because, well, that in on one side that can be helpful because it's a lot of people coming together talking about shared experiences. But TikTok probably can't diagnose you. You maybe would need to talk to your therapist about that.
Yes, exactly. It can lead you to curiosity to have that conversation, but you do want to have that with a licensed professional.
Great. Well, thank you so much, Libby, for those answers and that exciting conversation. We're going to move on to the Q&A portion now. So if you have a question at all, and there are no dumb questions, no dumb questions at all. Please just keep it to, general information, nothing personal. Libby is not here serving in a therapist capacity. She is here in an informational capacity. So, and you're not even licensed in Indiana. So, okay, so let's get to it.
All right.
So our first question kind of harkens back to the note taking and the judging. Someone asks, is my therapist going to be offended if I don't like them?
Great question. I want to say no. I want to say, once again, how it should be is we are not supposed to have any bias or sense of judgment. We cannot bring that into our practice. So if that is just, if you just do not connect with that person, that's okay. We are not, once again, we're not supposed to personalize that, right? We're supposed to take that information as, hey, this is not the right fit. What can we do to help you find your person and find that fit that suits you well? You're allowed to have your feelings and you're allowed to not prefer someone over someone else. So yeah.
Okay. This next question is kind of in the same vein. Another person asks, I have now tried out 3 therapists and haven't really liked any of them. Am I being too picky? If not, what do you recommend I do to stop having to waste money trying out new therapists?
Yes. I think that's a great question. So, I never believe that anybody's being too picky. You deserve to receive the services and support and, everything you need. You deserve to have that, and that there is someone there. It's frustrating because it can take a while and that can be disheartening. I always encourage people, maybe take a break. For searching, if it's been too much and you're just not wanting to re-engage, but maybe take a break, but you deserve to come back to it. Once again, I don't think you're being too picky. I think something that might be helpful is asking or looking for therapists that could do an initial phone consultation. Usually that's free. It should be free. And that can be like a 10 to 15 minute phone call to kind of just basically see, hey, is this a right fit? Of course, it might feel like a right fit. You go in and then, it's not. That's okay. That happens. But sometimes you can spare some time and money and resources by doing an initial just phone call and just asking those questions that are really important to you.
Yeah, kind of going back to what you said about like hiring and firing your therapist. When I go into a job interview, it's an interview for that company as much as it is for me. So maybe viewing that initial like consultation as like, hey, I'm going to interview this person to make sure they're a really good fit. I can relate to this question. I only look for a specific gender, a specific license. I really only look for social workers. There are specific like I don't look for like psychiatrists, like things like that. And I look for someone who shares the same values as me, and that it can get really, really overwhelming. Something personally that I do is I just search for like 5 minutes a day, and then I put my phone down and I save people who I'm interested in. And then I'm like, okay.
Yep.
Moving on.
Like healthy boundaries to maintain. So I love that. Yes. And it's so important. This idea of hiring and firing, it's supposed to be an empowering language to reiterate that you are in charge of your own therapy. no one should be running an agenda for you. You should be able to go in there and say, hey, this is what I want to focus on. Or if you don't have anything to focus on in particular, that's usually when we'll go back to those goals that we talked about in the initial intake session, which is the first session. So you being able to hire, making sure they're a good fit for you too, that's so important. And then also being able to fire, because if it doesn't work for you, it doesn't work for you. And that's okay. And that is just part of this process. And so us therapists, we anticipate that. We anticipate there to be mismatches and to refer out and to support. Should not personalize that. That's just part of the process. We actually should celebrate that and be excited that clients are using their voice to get their needs met.
That's great. All right, another question is someone asks, what is group therapy?
Group therapy. Yes. So group therapy is separate from individual therapy. So individual is just one-on-one. So it's just the therapist and the client, where group therapy, it's typically in a group setting with other people. So maybe there's one or two therapists that are leading the group, but outside of that, it's just the rest are patients or clients. And a lot of the times you can hear group therapy as like support groups. So, a great example for like people who have lost somebody or someone who has passed. So there's grief and loss support. There's support groups for people with chronic illnesses, disabilities, substance abuse. And sometimes there's even just group therapies for like practicing skills. So like mindfulness, or relationship skills, coping skills. So that can be nice if you're looking for a group effort to support you and have that connection and solidarity of you're not alone. Everybody else is needing that support and space. So that can be really nice. Sometimes it can complement individual therapy as well. So yeah.
I also do know that sometimes group therapy can be more accessible in terms of cost. That's what I'm trying to say.
Yes.
Sometimes I've noticed that in my own searching, and there are like you said, very specific support groups that are all different topics, like a queer support group, or maybe even like a couples support group. And I feel like it can be anything.
Yes.
Anything that therapists have experience in. All right, we're going to do one more question. And this question, I think, wraps this conversation up really nicely.
Yes.
How do I do therapy right?
Yes. Beautiful question. And my response to that is this is the best part of therapy, is that there's no right or wrong way to do therapy. That's the exciting part. If we focus on, individual talk therapy sessions, you'll typically meet with your therapist in a private setting. So in their office, usually white noise or something is going on. So you feel extra protected from what we're talking about. And the sessions can run anywhere from like 43 minutes to a full hour, just depends. And during that time, it's really just space for you to discuss any current situations, maybe processing emotions that are coming up, or focusing on the goals that you initially discussed in the intake session. But really, there's no wrong way to do therapy. And that goes back to that you are in control of what the sessions look like, what you want support in, what you don't need support in. So that's why I think therapy can be so intimidating, because it's like, how do I show up? And you just have to show up. You just have to show up and be you and lean into what you want to work on. And that therapist should be more than willing and excited to lean into that with you.
Great. Well, thank you so much, Libby. Round of applause. I really enjoyed talking with you today. So in terms of wrapping it up here, so thank you all for your questions. Thank you so much for being here in our last moments here together. I am going to share my screen again. and I have a survey for you. So this survey is ooh, the survey is via QR code, so you can scan this with a mobile device and it'll immediately prompt a survey for you. You also can, when you leave here today, there should be a way through Zoom to access the link. If not, if you'd like the direct link, please feel free to email me. My email is here on this page. It's just E. McCready, my last name, at carmelclaylibrary.org. So if you want the direct link for that, you can just email me and I will shoot it over for you. In terms of our next Wellness Wednesday is in July. We're taking a bit of a break in June. We are hosting the Domestic Violence Network, or DVN, for a discussion on healthy relationships, which Libby mentioned is a thing that you could explore with your therapist. So we will be exploring healthy relationships and healthy boundaries with the Domestic Violence Network on July 19th from 6 to 7 p.m. And that's here in the main branch of the library, 425 East Main Street. You can sign up on our calendar just the same way that you got here. So under the calendar tab under our main website, which is carmelclaylibrary.org. So again, thank you, Libby, for joining me. Great conversation, great topic. This conversation will be posted on YouTube, hopefully in a couple of days. So share with your friends, share with your mom, your dad, your family, coworkers, your partner, whatever you want. Thank you so much for joining us, and I hope you all have a pleasant evening. Bye.